Dr. Jerry Abraham is the vaccine director of Kedren Health Center in South Los Angeles, and he joins me now. Dr. Abraham, welcome. Great to see you. So President Biden will be announcing all adults in the U.S. will be eligible for the vaccine on April 19th. But as you know, the number of new cases continues to tick up, and some experts believe a fourth wave of coronavirus cases is imminent. How does this new April 19th deadline impact a potential fourth wave?
Sure. Thank you for having us. First, I'll just say I'm super excited that we're making this vaccine eligible now to all adults in America, and that is critical. Here in California, April 1st, we increased eligibility to everyone over 50 years old. And in California, we applaud our governor for making eligibility on April 15th for all adults. So we really look forward to this move by the Biden administration and making vaccines as accessible and as equitably distributed across this country. And we know that's definitely a big part of the solution. We can't get there fast enough. We must achieve this herd immunity now.
And just a question about logistics. Do we physically have the number of vaccines to do this?
Thank you so much for that question. We saw what's been happening with some of the supply, some of the spoiled batches, this, that, or the other. But we're finally, I believe, this week at a place where we can kind of say supply is keeping up with the demand. We're excited about everybody who's got their sleeves rolled up outside of Kedren right now as we're dancing and vaccinating. But we know that we still need more Johnson & Johnson, more Moderna, more Pfizer. The demand is still very high. And thankfully, I think the supply is now coming. But we need to keep the pressure on manufacturing. And we need to make sure this vaccine gets out to the hardest to reach places. My community here in South LA, parts of rural America, they still have not been able to access this vaccine. And we must address those concerns because we can't do this unless 70% of all of us really have this herd immunity.
And what can you tell us about this potential fourth wave that seems to be affecting younger people a little bit more, simply because I suppose they have not been, as largely vaccinated as a group, and perhaps the younger folks are a little bit more out and about. But the upside of this is that they don't seem to be getting as severe cases. There are fewer hospitalizations and fewer deaths. What can you tell us about that?
Sure. I'll just first start by saying, as we race towards ending this epidemic, we must achieve 70% vaccination rates. Well, if 20% of my community are minors who are ineligible, that really becomes a much more difficult task. So, of course, we're watching very closely Pfizer and Moderna and the FDA advisory panel and the independent review boards that are monitoring and seeing when eligibility will open up for younger and school-age children. That's definitely going to be a part of the solution. It's also a reminder that because vaccines are available, that doesn't mean that we stop doing what we've been doing, and that's following our public health orders, including social distancing, wearing a mask, washing our hands, and doing all those things that keep our workforce, our schools, our teachers, and everyone safe. Now is not the time to let down our guard. We can still do things like recreational activity safely, but right now is not the time to go and clamor on a beach and expose all of ourselves. This fourth wave is real, and depending on what we do, we are already seeing it here in Los Angeles, hospitalization rates, critical care admissions ticking upward. We don't want that to happen, especially when it comes to our young and healthy. This virus kills. We know that. We don't need young people needlessly dying from this just because we decided to party for spring break.
Really important information to get out there, Doctor. Thank you. Now, the FDA has issued an emergency use authorization for, quote, the first antibody test authorized for use with home collected dried blood spot samples. Tell us what this means for the future of at-home testing. How does this work? And how will this aid the nation's efforts to combat COVID-19?
Sure, and not all testing is the same. We've got the rapid 15-minute antigen test. We've got the PCR test that you get the result in 2 days or so. And now with antibody testing, we really can know if you've got long-term IgG antibodies that, you're protected. Now, that's a quantitative versus qualitative test. These things start to get very complex and complicated. There are different parts of the virus that you're looking for with some of these tests. What we know is that some of them are looking at the spike protein itself, and some are looking at other pieces, whether you have antibodies. So this is not definitely a test that's going to tell us for sure that you're safe, because with the variants, you're going to need to look at other pieces if you actually have immunity or the correct antibody. So I know that's a complicated question to a very answer to a very complicated question, but the truth is it is one step forward to knowing if you have protection, but just know when it comes to variants, we do test for different pieces of the virus, and you may still need to go to the doctor and get your blood drawn like you normally would have to know if you're truly protected. But testing is just one piece of the puzzle. Those 15-minute tests are still good. Those PCR tests are still great. I don't want everybody out there running around trying to get an antibody test because that's really not necessary.
All right. And Doctor, this goes back to what you were saying earlier about not letting our guard down. But according to a recent Gallup poll, Americans are less concerned with catching COVID-19 than ever before. New data reveals that 35% of the population is worried about contracting the virus, and that is down from 49% in February. So is this lack of concern something we should be celebrating? Is this lack of concern warranted, first of all? Or is the success of the nation's vaccine rollout providing perhaps a false sense of security for Americans nationwide?
Yeah, I think this really is we have to follow the science. We have to follow the recommendations of our NIH and our CDC. These variants are real and they do increase rates of COVID in our community. Some of these variants are more infectious. There is reason to believe that some of these variants are more fatal and deadly. So we really don't have the luxury right now to let our guard down. So of course it's concerning as a public health scientist, as a family physician, to see people leaning back, not as concerned. As Easter is here, people are going back to church, people are spring breaking, we're trying to get back to work and school and worship and play. We need to do those things safely. It's not worth it for us to go back through that awful year we've all suffered through. So let's be patient, let's be vigilant. We can do things safely though, and that we're learning every day. So don't think that this is isolation and going back to those earliest days when we had very little information or data. We just need to be mindful. And so yes, all Americans should continue to be concerned about this virus, this pandemic, and be vigilant and do their part. Wash their hands, socially distance, wear a mask, and get vaccinated when you are eligible and it's accessible to you.
But of course, as you know, this has been spring break for a lot of people. We hear reports of the airports being crowded, flights being full. We haven't seen that in a long time, in this country. And then, of course, this UK variant of the virus has been reported in all 50 states. We've also learned about a double mutant variant from India being reported in the San Francisco Bay Area. So are these the types of strains that, when we go to a crowded airport or we find ourselves in a packed airplane, are these the sorts of strains we should be worried about?
Yeah, I mean, these are all very delicate questions and there are no easy answers. Is travel playing a role in spreading these mutant variants? Absolutely. So we really want to restrict our travel to essential travel, that which you must do for work or to see an ailing or an aging relative. Those kinds of things. Right now is not the time to say the pandemic is over. Unfortunately, our behaviors are truly contributing. In addition to the virus doing what viruses do best, they are going to continue to mutate so that they survive, so they can continue to spread. And we must also then augment our strategies so that we can combat it well. But of course, the double mutant is very concerning that we've seen here in Northern California. Of course, it's very concerning that a more infectious and possibly more deadly UK variant is now all over this country. We're watching the situation in India closely, in Brazil and others. We've had 2 variants emerge from Southern California itself. So this is not over by any means, but we need to be smart and safe. And yes, our behaviors are contributing to whether we dial up or dial down and whether the infection rates increase or decrease. Be smart, wear your mask, wash your hands, socially distance, get vaccinated. The end is in sight and we see that light at the end of the tunnel. We're excited about that, but do not, be careless yet and do not get too excited too soon. We must still continue to play our part.
We can't jump the gun. Dr. Jerry Abraham, thank you so much for joining us. We really appreciate it.